Welcome to the Health and Safety Back to Basics training. This training was designed to provide you with an overview of the basic components that need to be in place in order for a child care center to operate safely. Each area must work together so that these needs can be met. My name is Sharon Haynes. I will guide you through today's training. It takes a team, and you hold the key. We count on our education staff, our frontline people, to lead the charge in keeping our precious bundles healthy and safe. How is this done, you may ask? Education staff must conduct daily sweeps of the facility and the classrooms during opening, throughout the day, and closing in order to ensure that the health and safety components are in place. Although health and safety of our children is everyone's responsibility, our education staff hold the key to compliance. Now let's take a virtual walk through a child care facility in order to discuss the items and practice that are considered the basic focus of a health and safety inspection. Upon entering a child care facility, one of the very first things you should see are the bulletin boards full of public information. First, the child care licensing information should be posted for all visitors to see upon entry. The facility's child care license, the inspections such as the fire inspection and well inspection if you have a well, past child care licensing inspections, the staff credentials such as the director's credential, and the staff's first aid and CPR certifications. Also, the health boards and parent information boards must be up to date with the nurse information, menus, and etc. The program's illness policies must be kept in a binder and readily available upon request. Next, the emergency telephone numbers, as well as the address and directions from a major intersection to your child care center, must be posted near the center's telephone. This is very important because during an emergency situation, sometimes people panic and they are unable to remember specific directions to your site. Also, each classroom must have a first aid and CPR poster posted in an area which can be easily seen by staff. Lastly, staff, children, and visitors must practice hand washing procedures upon entering the facility. The staff must also practice hand washing procedures as required by your program during diapering as well. As we move into the classroom, one of the very first items the inspectors will look for are the electrical outlet covers. These covers come in various styles. Some programs have opted for the built-in covers. Any style is fine as long as they are being used. Please remember to look at your power strips too. All available outlets must be covered. While we are looking at the outlets, be sure to check the electrical wires to make sure that they are tied up to avoid any tripping hazards. Next, let's look at the classroom furniture. Check for the presence of rust, chips, cracks, and anything that can cause injury such as unstable furniture or broken pieces. Lastly, are the staff using universal precautions? Ensure that your staff are using gloves during the cleaning of the tables, the cleanup of bodily fluids, diaper changing, toothbrushing, and preparing food. Check your health policies and procedures to guarantee compliance. Let's look at table cleaning. According to the Environmental Rating Scales Institute, the following table cleaning procedure must be followed for early childhood centers. First, remove the food particles. Next, use soapy water solution to clean the table with a paper towel. Then, spray bleach water solution on the table. Wait 2 minutes before drying with a paper towel or air drying. Please remember that staff must wear gloves during this procedure. We need to also remember that toothbrushes and toothbrushing practices are the keys to good health. With this premise in mind, many programs require that the toothbrush holders and the covers to be washed weekly with a soapy water solution. Once the holder is dry, the toothbrushes can be placed back into the holder. Our program also requires that toothbrushes are labeled with the child's first name and last initial. When preparing for brushing, the staff must use universal precautions by placing gloves on their hands, prepare the toothpaste, and hand the toothbrush to the child. Also, our toothbrushes must be replaced every 3 months. Of course, if the toothbrush drops on the floor, or if the nurse requires that the toothbrush needs to be replaced due to a child's illness, these toothbrushes must be replaced immediately. Be sure to check with your program's requirements in this area. Our program also requires that education staff model the appropriate toothbrushing practice for children. There are many programs available to use with early childhood programs that help teachers model how to brush teeth. Whether it's a dinosaur or a toothbrushing song, it's expected that the staff use it on a daily basis to teach and model toothbrushing. Our staff are expected to brush infant and toddlers' teeth using the recommended toothbrushing tools, whether it's a tooth wipe like Spiffy's, infant toothbrushes, large-handled toothbrushes, or regular toothbrushes. Posters modeling toothbrushing practices must be displayed near the sink to use for toothbrushing. Health and safety requirements are also imposed on the kitchen area. Our staff must follow the following policies. First, the refrigerator must be maintained at a temperature of 41 degrees or below according to an inside thermostat. The cleaning supplies are stored separately from the food. The food is stored 6 inches from the floor. The kitchen must always be clutter-free and free of health and fire hazards. Our menus and special diets must be posted in the kitchen as well, and the kitchen must always be free of rodents and insects. Our staff must use gloves when prepping food and cleaning the kitchen. Hairnets, bonnets, aprons, etc. must also be used during food prep. Properly disinfecting and sanitizing the equipment, toys, kitchen, and bathroom are critical in order to maintain the health of the children and the staff. The following guidelines reflect our policies and procedures. Please refer to your program and your local licensing agency for the requirements in regards to the use of bleach water solutions for sanitizing equipment, toys, and kitchen items. According to CDC guidelines, the bleach water solution is prepared by using 1 teaspoon of bleach to 1 quart or 4 cups of water. It is recommended that a 3-compartment sink be used for washing dishes. The sinks must be sanitized before and after each use. Dishes are washed in a warm, soapy water in compartment 1. They are rinsed with clear water in compartment 2. And then they are immersed in a sanitizing solution in compartment 3 for at least 1 minute. Lastly, they are to be air-dried in a rack. A test kit must be used to test the concentration of the sanitizing solution before each use. The next stop on our virtual tour are the children's bathrooms. When you walk into the bathrooms, you should see hand-washing posters posted. Staff and children must wash their hands after toileting. Bathrooms must be clean and in good repair. And lastly, all bodily fluids must be cleaned up immediately using universal precautions. Additionally, Bathrooms and centers must be free of the urine odor. The last stop on our virtual tour through a child care facility is the playground. The staff must be completing daily playground safety checks to ensure that the playground is safe before each class plays. Each center should identify a safety person who will conduct safety sweeps of the playground and facility each morning. The playground sweeps should include areas such as the fence line, checking for trash and debris, evaluating the surface covering, checking the equipment for overall conditions, looking for stray animals and insect nests. To avoid a tripping hazard or compound injuries, monitor the surface of the playground. Are there any holes in the poured surface? Does the mulch need to be raked under a fall zone? Do you need additional mulch for the coverage on the playground? Let's talk more in detail about the fall zones. Mulch is easily kicked out of place by active children. It's everyone's job to ensure that the mulch is raked back into place after each play period. So, when the children are resting and getting drinks, a staff person can rake the mulch back into place before exiting the play area. Also, you could recruit a classroom volunteer to help with this task. Poured surfaces can be slippery with debris. It's best to avoid the slip factor by blowing the debris off before allowing children access to the playground. Some additional suggestions to help ensure an enjoyable outdoor experience. First, staff should ensure that all gross motor equipment and gross motor activities are developmental age appropriate. Duplicate toys keep disagreements to a minimum. Specific to our program, teachers are required to provide a teacher-guided gross motor activity for at least 5 minutes. This aids the teacher in assessing the children's gross motor skills. Tricycles should be in good working condition. Children must also wear proper-fitting helmets when riding tricycles. Our program requires that all children wear a hair bonnet underneath the helmets. The sandboxes must always be covered when not in use. Lastly, equipment should be felt in order to ensure that it's not too hot for children to sit on or climb on. This is essential for the southern climate. Preparing for outdoor play is equally as important. The teaching staff must ensure that the first aid kits are fully stocked and available during outdoor playtime. Our program requires that the staff wear the first aid kits in the form of fanny packs. Also, if you have a child who has an allergy that requires an EpiPen, the EpiPen must be taken outside with you during your outdoor playtime and stored in your first aid kit. Regulatory agencies require child care programs to provide unlimited access to drinking water for children and staff while on the playground. Also, water must be available for hand washing. Children who want to play in the sand and water area must wash their hands before and after playing in each area. For additional playground training, please review our Back to Basics training on playground safety at earlychildhoodconnection.org. This training was intended to give you an overview of a common sense approach to health and safety in early childhood care centers. Always check with your local child care licensing program regulations. Additionally, check with your program's policies and procedures as it relates to health and safety guidelines. Works cited: Cryer, Harms, and Riley. Table Washing Procedures, Environmental Rating Scale Institute. Dr. Angela Frazier, Food Safety in Child Care Centers and Family Daycare Homes, Food Safety Education. FY Year 2015, Office of Head Start Environmental Health and Safety Protocol. Additional work cited: Sharon A. Haynes, Playground Safety Back to Basics Video, earlychildhoodconnection.org. Hillsborough County Child Care Licensing Ordinance 14-39. How to clean and disinfect schools to help slow the spread of flu and seasonal influenza. CDC. Thank you for your participation in today's Health and Safety Back to Basics training. Remember, we are the key to keeping our children healthy and safe while in our care.